Hello, everyone, and welcome to the Brownstone. I'm your host, Dr. Michelle, and you are listening to Numbers Don't Lie. We learn to get out your feelings so you can make the best decisions for yourself, your family, and your business. So, guys, we are in Women's History Month, and we've already gotten off to a great start. The actual network you're listening to is owned by a woman, but I'll leave that for later. We're gonna learn more about her later this month. But today I have a special guest that's in the healthcare field. And when I say this is a bold sister, okay, like the the bigness, that's probably not even a word of what she is doing, not even trying to doing, it's going to rock your world because many of you have interacted with the healthcare system, maybe have walked away feeling some type of way. Maybe you know someone that has been impacted by being neglected in the hospital or maybe not feeling heard. And if you're in the research world or ever been in the research world like I've been, you know that of what I'm talking about. And we call those things disparities, right? Racial disparities. There's a difference. And education cannot describe it away. Income cannot explain it away. So we know there's a systemic issue here in the United States that has to be dealt with. And my next guest is trying to take it head on in a unique and creative way. So today's episode is entitled Women Making History, Dismantling Health Disparities in America. So guys, please welcome to the stage, welcome to the Brownstone, Kimberly Smith.
Hi everyone. How are you doing?
Kimberly, I'm wonderful. How are you?
Oh, I'm doing good. Doing real good.
So, Kimberly, can you just dive in and tell us a little more about yourself? You don't have
Okay.
to like stick to one area, whatever comes out, just let it flow.
Yeah. Well, I will tell you, I just feel like one of the girlfriends. I am a mom, a wife. My husband and I, we are raising our three sons in the beautiful South Carolina, his home state. Yeah. And I've worked in healthcare for about 18 years and love it and really look forward to helping uh, I would say transform the health of our health system in America.
I like that, transforming
Yeah,
the health of our healthcare system because our healthcare system is something special.
it is. We have some opportunities. Yeah, we have some opportunities.
Optimistic she is. Said, oh, it's opportunities. She didn't even see it as like negative, like, oh, this is an opportunity for us to do some great things.
That's
So
right.
you see how the bomb she is. But I knew that she belonged on this show when I was just having a conversation with her about something else last week. And she said, oh, yeah, I love data. And I said, oh, okay, tell me
That's
more.
right.
Yeah. Data tells a story. I'm like, yeah, okay. And y'all, the more we kept talking, the more I knew she belonged on this show because the word needs to get out. You guys need to be educated about the healthcare system and how you can participate in making it better. And so Kim is doing some amazing things. So let's get into it a little more so she can tell you more about it. So Kim, you have experience working directly with hospitals. What kind of impact did you intend to make while you were there?
Wow, that's a great question. And I would first say my original intent when in going to grad school was actually going into public health research. So I was very set on improving the health of communities. And I decided to transition to the hospital setting after a mentor encouraged me by saying, you look like you belong on the business side of
Mm.
hospitals. So my intent, of course, was the business side, making sure that hospitals and medical groups were viable, they engaged with their people in a way that was meaningful, but also that communities were healthier. You know, in most communities, hospitals are the largest or one of the largest employers.
Mm-hmm.
And it's important that those organizations run very well. And if they don't, then it does not help the community get healthier. So that it has it's different from any other industry that you can be in. The health of the health system directly impacts the health of patients. So that was definitely the goal.
That's so good because it's funny. Kim said she started out in public health in the research field. Well, that's actually what I came out of.
Yeah.
So I'm an epidemiologist by trade, and one thing that my advisor she focused on a lot was the impact in rural communities. And I don't know, about other states, but in South Carolina, that's a huge thing. And when hospitals shut down, a lot of times it starts in those rural communities first, leave them in even worse situations. So they got to travel further to get to a hospital. If it, God forbid, it's an emergency. So you are spot on about, I mean, just, it's a business. It directly impacts the health of that community. So kudos to you for taking on
Yeah.
such a huge, I don't even know what to describe it, mission.
Yeah, I will tell you, I mean, growing up in North Carolina, our family was very close, and there was one particular hospital that we just were a bit leery of. No one really trusted this system. So I will tell you that the relationship between the people and the hospitals is very important for that to be positive, whole, because a lot of times you're depending on those relationships and that trust factor to in times where you need it the most. You
Mm-hmm.
need people to know how to engage with you, how to connect with you. And I saw that firsthand, where there was a lot of distrust with health systems growing up in North Carolina. So it was definitely, that rural health is powerful. My first job, my first graduate school job, was with the a rural health research center in South Carolina.
I
So yeah,
work there
you
during
did.
graduate
You worked for the,
school.
yeah, for with the, yeah, those leaders, the dean. So that was my first position at the South Carolina Rural Health Research Center, and studied the corridor of shame. And
Yes.
man, it's so important to understand rural health, and it's not, honestly, not just in the U.S. but globally. It's a big challenge,
Yeah.
making sure those folks aren't left behind.
Yeah, that's good. And for those that are
Yeah.
listening that are not from the Southeast, or maybe even in research in the Southeast, she mentioned a corridor of shame. That's literally that those communities that surround Highway 95 South,
Yep.
and they have worse health outcomes than the rest of the state. So it's a real thing. You can Google it. I actually encourage you
Yep.
to Google the corridor of shame and look at the difference between the health statuses, diabetes, heart disease, compared to honestly the nation and then the state as a whole.
Absolutely. Wow. We have connections. Every time I talk to you, something else comes up.
I know. So you were meant to be here.
That's right. That's right.
So tell us your thoughts about how health disparities are covered in research. And what I mean, I don't know if that question is really vague, but what I mean about, it's mentioned. You know what I mean?
Yes. Yes. Yeah.
Okay.
It's interesting because I do feel as though um, we're moving in the right direction, but the pace in which we're moving is not, um, it's not something I'm proud of. And there's a personal reason why, if you don't mind me just sharing. So on March 11th, of this year, will mark 11 years since I survived HELLP syndrome, which is a pregnancy related health disorder. Um, to put it kind of bluntly, it happens in 4 out of 1,000 pregnancies. It's life threatening. So in this incident, returning home from visiting family, I was 21 weeks pregnant and my blood pressure shot up to 200 over 100. I literally could have lost my life.
Mm.
We lost our daughter, Lauren Kelly, and thankfully I am alive, but it shows you that statistic on Black women being 3 to 4 more times likely to die in childbirth. I was linked to that disparity and could have been, um, honestly, not here with you today. So when I think about health disparities, it's something that I've really been, not just fascinated with, but I felt a calling and a pull to study and to be an advocate for. And so about a decade ago, there was a huge push to bring awareness on this one particular example of Black women's health. And a decade later, I'm very proud. People are more aware. There are organizations that I even had the chance of talking with, and reporters I was able to speak with to shed light on this particular issue. But to be honest, the stats are still horrible. Over a decade later, the stats are horrible. So what has come up in a lot of the conversations that I've been in, whether it's on board seat or just on a task force, it's this whole question around, well, we need more diverse uh, um, clinical investigators. We also need more people like you and me, more BIPOC community members participating in research.
Mhm.
So there's more awareness, but there's also almost this, there's this stigma amongst, which is honestly, there's a reason for it. There's this distrust for being involved with clinical research. And there is this assumption that from sometimes researchers that, well, Black communities don't want to engage. And there's a hint of truth on both sides, where there's so much opportunity to come together through education, through building relationships. And my number one word is connection. If
Yeah.
we really figure out a way to connect and address those challenges, it'll help. It's sad that there are so many drugs and studies that are designed to help communities like ours, but oftentimes, I mean, really all of us, but oftentimes we're not even included
Mm.
in the research. And that's
Yeah.
just one example, because there's so
Mhm.
much research beyond making drugs, right? Um, but it's kind of scary to think all of these, cancer medicines were designed around white men, or for the most part, or what have you, because we're not showing up.
Yep.
And also, not to put it just the blame on us, we're not always invited to the table.
Mhm.
So there's a lot of my work and passion is around understanding what are the gaps in research, being being clear on, okay, how often are we invited to the table, and amplifying the voice of the diverse patient as the greatest answer we have to closing the gap on health disparities. So we're moving. We're aware. Bravo to us. But let's move on that. Turn that understanding into some meaningful action. You know how I feel about that.
Absolutely. Absolutely. Kim and I shared like this same sentiment about that. Like, okay, we've done the research is done. We see it over and over.
Yeah,
And like she mentioned, some statistics have stayed the same for decades. And I mean, depending on which area, some have gotten worse. In the financial area, sometimes it's gotten worse. So
that's
we
right.
we recognize it as a problem. But yeah, so Kim is actually doing some work to help get ahead of it, and like she said, put some action to it. And I'm going to get to it, but I want to remind, for those that just tuning in, that you are listening to KCCR the Brownstone. Welcome to the Brownstone, guys. And one thing we like to say is welcome home. So I hope you feel like you're at home. So you're in Kim's office, you're in my loft here in the Brownstone. So we want to make sure that you feel at home, and also remind you of how you can listen to us. You can listen to us on brownstoneworldwide.com, and also KCCR the Brownstone, the app. So you can listen to us on the go. You can also jam out to some music as well. And then you can also follow us on Facebook at Brownstone Worldwide. So you have a page, we have some cool stuff going on. And on the website, brownstoneworldwide.com, there's actually a lot of really great stuff in there. There's articles, there's news, there's actually a magazine that you can subscribe to, Brownstone Living, and your girl has an article in there. So you got to make sure you go check it out. So when we head over to the brownstoneworldwide.com, the cover for Women's History Month is the bomb. Let me tell you that, okay? It's fierce. It speaks boss. It speaks empowerment. So if you're a woman, you need to be empowered. You need to get that magazine, okay? Okay, let's come on back. So Kim, I feel like you was like right there about to tell us more about what you do. So if it's okay, we can go in that direction, and give
Yeah.
us a little sneak peek of what you're actually working on.
Oh yeah, yeah. I'm so excited. So I've really always wanted to be out on my own. It's funny. Sometimes when you're in corporate America for some time, it feels like you're supposed to stay
Mm.
um in this path. But I always had an entrepreneurial spirit, and have recently launched my own health tech firm, which I'm super excited about. And it's really coming together. So my company is called Health Evolve Technologies, and we are building equity in care and culture. And we're really doing it in three different segments that all come together. One is research, which I'm super excited about. So we have our health culture index tool, where we're really helping organizations learn how to measure equity in care and culture through the voice of their patients. So we're putting them at the center of this. The second area is we're building clinical applications for consumers. And third, we're building our own ecosystem of brilliant, diverse clinicians from around the world that are going to be providing incredible content and meaningful stories and things that really help patients connect with people that look like them, re-engage in the health system, and take control of their own health. We want people to be healthy. We want people to live long lives.
Yes.
And doing this in honor of my loved ones that have passed from disparities, and just my mission to change and change I would say the landscape of what we're seeing today, because my grandkids are not going to face the same challenges. I just refuse.
I like that. I like that.
Yeah.
So what we do today can totally shape what her grandchildren, your
Yeah.
grandchildren can
Yeah.
experience tomorrow, because we don't want to say, oh yeah, it's
Yeah.
still like this. Black women are still 3 to 4 times likely to die in childbirth, after childbirth. We
Yeah.
y'all.
It's
Because I
so
know
crazy.
it.
It is crazy. And here's the thing, it's getting super, super expensive. It's been expensive for a long time, but now you know how people are with stats. We get mesmerized from the data. So there's one stat that's out from Deloitte that it costs about 320 million a year. That's how much we spend in health disparities type things. And that should reach about 1 trillion by 2040. So we have 17 years, right? Now in 11 years, we haven't changed Black women's health. Okay, so let's put it in perspective. So instead, we have to be intentional about shaking up how we do things. It cannot be status quo. You know what the cool thing is? There are organizations that are doing a lot of cool investing and support of these kind of efforts, including academic hospital systems. I mean, most of them have innovation centers, and they have an interest in equity. There's more regulations on hospitals and pharmaceutical companies on disparities. So there's an interest, and there's also accountability. But my job as a company is to help them actually execute it, because they're still trying to figure it out.
Yeah.
So perfect timing, right?
Perfect.
Yeah.
So
Yeah.
Kim, a lot of times people just interact with like the nurses, the doctors, the staff, and they may have experience maybe feeling like they're unheard or disregarded or not taken seriously. But we talked about before that that's a downstream problem.
Mm-hmm.
What are
Right.
some things that, because I know you kind of mentioned it, can you kind of help us understand some of those upstream things that need to be aligned so it'll flow downstream and we can start to feel included or, appreciated or cared for when we go to those healthcare places?
Right. I mean, that's a really great question. And my response may surprise some people, but hopefully you take it as what it is. But I am a huge believer in being in the room. I'm a huge believer in, it doesn't matter your title, it doesn't matter if you own a business, you should be in somebody's boardroom in a hospital as a community member, as a patient.
Yeah.
And there are and this is one example, because the hospitals are not the only organizations you should be partnering with. But all of them should have a patient advisory council. That's very, very important. It's community based. It's supposed to include people that are members of their community, that are active patients, that are, leaders potentially. Those aren't always diverse groups. I'll just say that, and not intentionally. It's just that
Right.
sometimes we don't know those things exist, or those are opportunities for our voice to be heard. And that's at the very high level. Those councils are run by executive team members, the chief nursing officer, you have the ear of that individual, the CEO, who also reports into a board. So when I think about leaders in the community, I think about, okay, what tables are they in? What rooms are they in? because often they are the ones that are going to echo the voices of the voiceless. So I think it's really important because in those types of conversations, you have an opportunity to really push the dialogue around, okay, I understand this is for all, right? Everyone wants to be heard. And that may be a challenge that a lot of patients feel. But unfortunately, in my community, I have not being heard. That links to a really, really poor outcome and
Mm-hmm.
potentially death
Yeah.
compared to another community. So it's not that one person is more important than the other. It's all about equity,
Yes.
right? So it's really important that you know what tables and what rooms exist where you're needed. So that, and to me, part of that is making sure that hospital systems know you're interested and you exist to participate in that. So when you get all the way down to not feeling heard, not feeling needed, being in those council meetings myself, I would hear the stories
Yeah.
from the patients that were in the room or completing your surveys, engaging in that way. I would have to respond to that as I led a very large medical group for an academic hospital system. So I would call patients
Wow.
personally and engage with them so know that there are avenues for you to be heard. So I would say push to see how you can engage and be in the room with the decision makers. So that might feel a bit daunting for some people. It's not. I'm telling you, they want to know who you are. They want to know who you are. So I would encourage you, or individuals who are great leaders within your community already and vocal and bold. Google it. Type in your hospital's name, comma, patient advisory council as just one example.
Mm-hmm.
And get in the room it'll make a big difference for you for sure.
Thank you so much for that, Kim, because I think a lot of times we don't know what we don't know. And
Right.
so, that's a really tangible solution that we can walk away with in Google, because everybody know how to Google
That's right.
how they can get involved in their local hospital. So don't be afraid, y'all. Especially for those of you that like to work in advocacy and that like to represent other people and support. Like, you are the perfect person to go in and carry the torch. I know my niece really is a great advocate. She's 16, but she's like a great
I
advocate.
love it.
Yeah, so like she'll be like a really great person when she gets older to, be a voice for others. So those out there, go on
That
out.
is awesome. That's right. That is right.
And Kim, you said it ever so gently. You mentioned health equity, and I do want
Yes.
to clarify what that means. I think there's a misconception or maybe a misuse of health equity and equality.
Right.
They aren't the same, and I want the listeners to understand the difference between equality and equity. Could you help us out?
Oh, sure. So, and we think about just those base words. When I think about equity, you're really making sure that people get what they need. To me, it means you're meeting people where they are.
Yeah.
Equality is just equal. Everyone gets the same thing. And the reality is, in hospitals, everyone can't get the same thing. It has to be very, very personalized to what that patient needs. And healthcare is very complex. Think about your body. You lived a certain number of years eating a certain types of food with certain genetics from a certain background and certain exposures, and you show up. They need to make sure they can address you in a very
Mhm.
customized way. It's not new,
Yeah.
for hospitals, for any organization that deals with people, and even Target customized. They send you customized text messages on how you search and engage and shop. This is not new. Might feel like Big Brother, but for hospitals, that's important because it links to giving good quality care. So when I think about health equity, I think about meeting patients where they are. So if there is a barrier to trust or if you have barriers to access, it's making sure that you dismantle those and provide you care in a way that still gets you really great outcomes,
Yeah.
right? Versus other individuals. You cannot treat everyone the exact same. That's just not how that works.
That's good. That's good. And that's another opportunity to remind those that are listening that when you see others getting different treatment, get out your feelings
Yeah.
and know that it's not all about you, because
Oh
your
wow.
it's not always what someone else needs. Because I hear that a lot when I look on social media or the news. It's like an outcry because they think, some people think, oh, they got something that I didn't get. It's like, but did you need that? Like
Exactly.
it's not just about you. And so I think that's a good reminder. Like health equity is about making sure that everyone gets what they need so they can all experience a great outcome. But if you are, let's say you're already at 80% and you only need 20% to get there, and why would it be fair or make sense to give you 60%? I mean, if you're in the healthcare system, that might kill you. Like, let's not,
Exactly.
you know.
Exactly. And I'll give you an example. And I was working for like a quality improvement organization at the time, and was rounding in a clinic, um, and patients were completing their. And I wasn't working in this clinic, so hopefully this was okay. I was just being who I am. But there are patients, mainly elderly patients, trying to complete and fill out their uh, demographic sheets. You know, the sheets that you turn in right before you can see the doctor in this medical practice. And it was obvious that one gentleman could not read. He could not read. And so when I think about equity, and talking with the people that work there, they let me know a lot of their patients that come in can't read. So they will often have to send a nurse or a front worker to the waiting room to help patients complete very, very important paperwork with them, because you have to get that information from them, right? And I was actually, because I was there and I had hands, I sat in the waiting room with a few of those patients. This is not my clinic. I didn't manage this clinic, but was there observing and sat there and helped them get the information that they needed. But when I did oversee an FQHC, several clinics within a federally qualified health system center, I saw the same things. You know, I saw some of the same things. And this is just one example. That's not saying everyone with disparities can't read, because we can talk about those numbers, right? A lot of times, you know, when you think about income, it doesn't matter how wealthy you are, you're still at risk for disparities.
Mm-hmm.
You know, but so that's just one example of equity. Does everyone need a personal navigator, right, to help them adjust through the health system? No,
Right.
that's a waste of resources.
Mm-hmm.
But to ensure there's health equity, you need to create a way to have some for individuals that need a way to navigate, so that, because both of you need to be healthy.
Mm-hmm.
One person might need a navigator, one person doesn't.
Yeah.
Does that make sense? So I mean, it's simple to me. It's just common sense.
Oh, you know, it's common sense to you.
I know.
Yeah, we have so many self-centered people that think it's about them and like that they're missing out on something. Like, y'all,
Right,
like
right,
just take a minute to like not to take it off ourselves.
right.
And that's
And I
really all
think,
it takes, being concerned about your neighbor sometimes.
yeah, and the funny thing is, yes, it's the right thing to do. But also, if everyone took a basic economics class, they would understand that, because sometimes people think, well, that's I'm paying for that. Well, what's the opportunity cost of
Mm-hmm.
communities being sicker? That's more expensive, and we're seeing it's more expensive
Is.
us not to invest up front to make sure people are healthy versus feel the cost, because you're going to feel it. The
Mm-hmm.
money, it's already here, right? So some people, because they don't understand basic economics, they don't understand investing in the community around you is an investment in yourself and your family.
This is so good. Y'all, this is such a good
Numbers
conversation.
tell a story.
I really want to keep going on, guys. We have reached the end of the show. Y'all, this was so good. And I know y'all gonna want to hear more from Kim. So we go, I got, you know what? There's like we go by themes of the year and the month. So I know we're gonna have you back. We talk about have a more of a focus on health, because there's so many people need to hear this and how important this is. And because some people just even aware that there is a different treatment in the hospital or in the healthcare system, or they're unaware that they can even get involved. So this has been so good, so needed. So I'm so appreciative that you just took some time out of your day to stop by the Brownstone and educate our listeners.
Yeah, absolutely. Thank you for having me.
So Kim, how can they, get in contact with you, reach out to you, or just find you on social media?
Okay. So you can reach out to, you can actually find my company at the website. It's healthevolve.co, so .co. And you can connect with me on LinkedIn. I'm at KimSmithCEO. Keep it simple. So KimSmithCEO, or you can go to our website, which is www.healthevolve.co.
Awesome. Well, guys, thank you again for tuning in. You've been listening to Numbers Don't Lie with me, Dr. Michele, on KCCR The Brownstone. You can follow me at Mogul Beginnings, MOGUL Beginnings, on Facebook and Instagram. And you can also find me on brownstoneworldwide.com. So it's been another great show. Guys, have a fantastic rest of your day. And until next time, see you guys.
Mogul Beginnings Data Consulting helps nonprofits and small businesses strategize, optimize, and scale by unleashing the power of their data. So if you're ready for your data to be unleashed to help your business tell beautiful stories, connect today by logging on to mogulbeginnings.com. That's Mogul